CBS News has learned the CDC has created a guide for local leaders on how to reopen public places and some businesses, but it was not released. The White House Coronavirus Task Force did see the document, but said it didn't want to make it public to avoid, quote, mixed messaging with President Trump's stance. The president has said he wants governors and local leaders to make the call on whether or not to reopen their individual respective states. The news comes after the president said yesterday the task force would stay open, contradicting the vice president, who said it would likely wind down. Major Garrett is keeping a close eye on all of these developments, and he joins us now to talk about them. So, Major, I want to get to the never released guidelines from the CDC, but let's start with the confusion over the task force. I was listening to the president describing why he decided to keep the task force open, and in my mind, the reason the task force was there and the reason that they were doing those daily briefings, of which you were providing a debrief on your podcast, was so the American people can learn and listen to our medical professionals, specifically Dr. Birx and Dr. Fauci, on what to do and how to sort of keep tabs on this pandemic individually. The president seemed to indicate that, a lot of people told him it's really, really popular. And so it just doesn't strike me that the president understands. I was listening to this and I just thought to myself, he thinks it's like a show where, it's getting good ratings, so why not keep it on the schedule?
Right. So those are elements of the Trump persona we have come to understand and cope with as a country. Some people love it, some people can't stand it. But this idea that the task force is in part a show and that he's the central figure of it and it got great ratings is something the president talked about himself. So that's not a line of attack. That's just quoting the president back to himself. But in the last 2 weeks, we've seen the briefings disappear. The president does take questions periodically at the White House, but in different venues. And the work of the task force, when he was in Phoenix just 2 days ago, was winding down. Those are his words and the vice president's words. And then it became clear that the task force still needed to be there at the federal level to ask questions, get answers, provide them to state and local officials, not because it's popular. That's got nothing to do with this, but because, well, first of all, President Trump can't believe anything he's involved with isn't popular. That's just marketing. That's his constant fallback default position. I'm involved, therefore it must be popular. But that the task force internally is a place where things are collected and discussed and then externally projected, whether through a briefing, the president's own words, or actions taken by federal agencies. But this idea that the White House did not want these new Centers for Disease Control and Prevention guidelines to be released to avoid mixed messaging is pretty rich, because mixed messaging has been part and parcel of this entire process for the Trump White House, veering in all sorts of different directions and leaving the public sometimes and state and local officials a bit confused about what the priorities are from the federal government. The simple truth is the president wants the emphasis of our conversation nationally to be on reopening the economy and doing so with safeguards and social distancing. But the priority is to reopen the economy, not to retain stay-at-home orders, lockdown scenarios, and take whatever health risks come with that central decision. That central decision being, we're going to reopen the economy and we're going to take whatever consequences flow from that. In the Oval Office yesterday, the president was asked, will there be more deaths? He said, yes, there'll be more deaths, but we're a warrior nation. We're all warriors now. The nurses are warriors. Americans are warriors, and we just have to accept that. So we have to accept more death as we reopen the economy. That's essentially where the president is this week. And I think it's a significant turning point in emphasis and rhetoric.
Major, so it's one thing not to release these CDC guidelines, but the federal government put out its own list of guidelines for reopening that many of the states that are choosing to reopen are not adhering to at all. Do you get a sense that the president would prefer them adhere to the federal guidelines, or prefers that they don't in a way so he has cover when, the death count inevitably goes up because people are going to be exposed to this virus?
Right. So there was a period of time a couple of weeks ago when the president was going through sort of a constitutional law crisis on live television. explaining to the country that he had absolute total authority over whatever governors did. Well, then there was an intervention of his constitutional lawyers and other advisors in the White House. No, Mr. President, you don't. States do have much of the authority in these matters. And so the president has taken a very deferential attitude toward that. The only thing he's really said recently is some governors are going too slowly. He's not really criticized, with the exception of Brian Kemp in Georgia, the speed and pace of reopening. And to your point, Anne-Marie, there does create an atmosphere where governors are the more responsible political actors here, and the president is possibly shielded from some of the blowback. But one thing that's been pretty clear about this pandemic, if you're only looking at it in terms of politics and approval ratings, governors in states that have had very tough times with COVID-19, be they Republican or Democrat, have seen their approval ratings rise. The president saw a little bit of rise early on, but it's now fallen back to his typical area in the mid to low 40s. Governors are more popular and have higher approval ratings for their actions related to COVID-19 than President Trump does. So even if he's deferring to governors and they're more popular, and that might provide him some measure of political cover, we still have to deal with this as a public health matter and an economic matter. And we're all involved in that. And ultimately, the person on the ballot for the most important election in 2020 is President Trump. And his main opponent right now is not Joe Biden. His main opponent is COVID-19.
Major, as you know, CBS News has also learned that President Trump's senior advisor and his son-in-law, Jared Kushner, had a role in getting PPE. A lot of inexperience, a lot of cronyism that seemed to have slowed his efforts to procure these medical supplies. You know, this senior advisor to the president, his son-in-law, is a jack of all trades. He's supposed to bring peace to the Middle East. Now he's supposed to help us combat this pandemic. What are you learning about his role in procuring these supplies?
So look, Jared Kushner is a significant player in the West Wing. He always has been. And everyone who knows Jared Kushner's role in the White House knows that when you put him in charge of something, he can get his calls answered more rapidly because people know he speaks to the president frequently. He has walk-in powers. He and Brad Parscale are effectively running the Trump 2020 reelection campaign. So Jared Kushner is a player, and putting him in charge of something like PPE from the president's perspective inside the White House prioritizes it to a level just a tick below the president of the United States. So he organized, Jared Kushner did, what you might in our common jargon call a pop-up committee. If we were back in Latin class or I was in college, we'd call it an ad hoc committee. But essentially, it was just somebody pulled together. Jared Kushner pulled a bunch of consultants from various consulting firms, smart people, to work on finding personal protective equipment supplies, getting them to the United States, and helping FEMA distribute them. Now, that's a noble goal, and in some respects, they have been successful, in part because of the prioritization that the Jared Kushner name carries. But they've also had some rather significant problems because they didn't understand purchasing processes within the federal government. They didn't understand customs rules. They did not understand Food and Drug Administration rules and regulations, all of which slowed down the implementation or completely buried ideas and notions they had about acquiring and distributing more personal protective equipment. I had a long conversation about this yesterday on my podcast you were kind enough to mention, Debriefing the Briefing, with Ro Khanna, Democrat from California, member of the House Oversight Committee that received a complaint from a volunteer on this very Jared Kushner pop-up committee who said, look, I was there. We were trying to do some good work. In some cases we did, but there are a lot of problems here, and I want Congress to take a look at it, and Congress will.
Wow, really interesting stuff, Major. Thank you so much.